So, if you'd like to tell us a little bit about yourself.
Right, so I'm Catherine. I'm a final year medical student. I've been at Nottingham University for 5 years. I did my BMed side project in immunology, looking at colorectal cancer and fancy molecules to do with that, seeing if we can find a prognostic factor for it. I've just done my finals, get my results tomorrow, so fingers crossed. And I'm hoping to go and do F1 back down in London, which is where I originally come from.
Fantastic. So, could you tell me a story about your time here?
Oh God. Which ones am I allowed to tell that won't get me in trouble? That's the question. I guess my first kind of trip in the labour suite with obs and gynae, that's been my best moment at university, because at Nottingham, I think quite a lot of medical schools as well, we're allowed to help deliver babies. So we did some training, we sat on labour and sort of watching the midwives do everything. And then the moment when they were like, right student, you can help this mother deliver the baby, I was like, what? Really? A real life? You're trusting my two hands to kind of take this baby, cut the cord and everything? I was like, crazy. But actually it was the most amazing moment of my life. I wouldn't change it for the world.
Wow. So what was your interview like? What sort of things did they ask you?
They always ask everybody at Nottingham the difference between empathy and sympathy. And the main things they try and get out of you during interview are your personality. They want to know that you're not just a robot that sat during A-levels, GCSEs, trying to get all A stars, all A's, which obviously you have to do. You have to have a personality, you have to have done other things. So I sing, I act, I play the flute, I've gone abroad to do singing and choral stuff. That was at school. And so what else do they ask in my interview? It's very focused on they ask you, why do you want to be a doctor? And you come up with something that isn't, because I care about people, because everybody says that and they just hate it in interview. They asked me why I wanted to be a doctor and not a nurse. That was a tough one. They asked the difference between empathy and sympathy. And then they very much focused on my personal statement. So at the beginning, I wrote a kind of paragraph about why I wanted to do medicine, and it was all revolving around my different experiences. So my dad has been in hospital for heart problems. My friend was in for mental health problems, and I was in for my surgery. So it was all sort of based around that. And then we kind of went off on a tangent. We were talking about depression. And one of the questions I really vividly remember being asked is, if one of your friends is really upset, what do you do? And I said, well, I sit down with a tub of ice cream and a film and just sit there and chat with them, and if they don't want to chat, we watch the film. That's how it works, isn't it? And they went, right, but what if your friend's lactose intolerant? And I was like, well, there's got to be something else they like. Chocolate, well, dark chocolate, sweets, etc. And I think we went on a tangent about our favourite flavours of ice cream for at least like a couple of minutes. So, I don't know, like interviews will go different dependent on what your personality is like, what you've written on your personal statement. Nobody really knows if they've got in or not until they get the letter or the phone call or the UCAS thing saying, woo, you're in. But if it goes disastrously, you never really know if it has. But if you really feel it has, go home, have a pint or chocolate or whatever makes you feel better and get on with life, because you can always reapply. A lot of people who take gap years actually feel they benefit more from taking a gap year and then coming into medicine a second time round, because they've had all that time to mature, which I think graduate entry medics compared to undergraduate medics feel they've got compared to us. I'm an undergrad. And they've definitely got a higher level of maturity and understanding of the world compared to us who have just come straight from school.
Yeah. So I've got to ask, first of all, what did you say as, why you want to be a doctor and not a nurse?
Okay, so I panicked just before my interview, because I was in the afternoon and I'd heard some people come out and kind of tell us what the interview questions were, because that's what people do. And I called my mum and was like, what's the difference between a doctor and a nurse? What do they actually do? And she said to me, doctors diagnose and treat, whereas nurses just treat. So I said that. I said that doctors get the best of both worlds. We get to diagnose the patient and to treat them, whereas the nurses just treat based on what we've told them to do.
Oh yeah, good answer.
So not insulting anyone.
Definitely. And what's your favourite flavour of ice cream?
Ooh, that's hard. It has changed. It's now half-baked because you get both the goodness of the brownie and the goodness of the cookie dough from Ben & Jerry's.
I like it. What's the one main piece of advice you'd give to anyone considering medicine?
Do work experience and make sure you really want to do it, because it's for life. It's like the puppy advert. You don't get a puppy for Christmas, you get it for life. Medicine will become your life, and you've got to want it to be your life.
Excellent. Any final thoughts to leave our viewers with?
If you do medicine, enjoy it, love it, and if you don't like it, leave. If you don't get onto medicine, enjoy whatever you actually do, because most people in the world enjoy their lives, whatever they go on to do.
Fantastic. Thank you very much.